Hey guys, I apologize that we weren't able to find a time during the actual orientation block or conference to get this information out, but I wanted to go through some of the basic benefit information for you as you start the enrollment process here, just so you kind of have an idea of what you're doing. This presentation is in no way meant to be comprehensive, but just kind of the very basics and the intro to this information. And for probably the majority of you will be enough to make a decision on kind of which benefits you should be enrolling in. But if you have any specific questions afterwards, you can always reach out to me or anybody from the HR. There's Advocate actually has like a concierge assigned to us that they're pretty helpful in answering questions about some of the benefits specifically. So very quickly, we're going to do like an intro to the vocab that you need to know to actually make these decisions. I'm going to try and show you how to actually access your benefits or explore all of them. We're going to look specifically at the advocate medical benefits. Very briefly look at the 401k just in like one slide, and then some other random benefit stuff. So before we get started, you kind of have to understand the basic terminology. We're all doctors, but don't necessarily always understand these basics. I know I didn't when I was a resident. So very briefly, kind of the terms you need to know when considering these options is a deductible, a copay, a coinsurance, an out-of-pocket max, and a premium. And I've kind of tried to explain these very quickly here for you. So a deductible is the amount that you're going to pay for your healthcare costs before your insurance actually kicks in. So if your deductible is $1,000, your insurance isn't going to cover any of your bills until you pay $1,000. And more and more frequently nowadays, you're seeing these high deductible plans, though Advocates is not terrible. A copay is a term for any flat fee that you pay for health services. So let's say you have a $40 copay for any preventative care. You know upfront that you got to pay $40 at the door just to be seen by the doctor. That's what I do when I go see my PCP or when I take my kids to the pediatrician. Coinsurance is essentially the same thing, except it's a percentage total rather than like an absolute dollar amount. So it can vary depending on where you go. The out-of-pocket max is the amount of money per year that you could be responsible for. So regardless of kind of what's charged to you or what the rates are, if your out-of-pocket max is $10,000, then that's the most that you could be charged in a calendar year. And then finally, a premium is the amount that you pay for health insurance. At Advocate, you guys likely know this, but you're getting a paycheck every 2 weeks. And so these premiums, everything that you're going to see on the screen is your 2-week premium. So you're going to basically be paying this twice a month to get your total. If you want like the full PDF on all of these benefits, I linked it to the website. So if you go to christcm.com, click on the resident tab, and then scroll down to where it says benefits and information. It'll take you to a PDF that explains all of this. Of note, you guys are enrolling for the 2024 benefits. And then later this fall, usually around October, they're going to release the new prices or any changes to the benefits that you'll have to enroll in for the upcoming year as well. So you're sort of going to do this twice in a short period of time. Hopefully it's not a lot of changes. I haven't heard anything from the HR people yet about what could be coming. So we'll kind of see. So in terms of medical coverage, the actual network that we are offered is United Healthcare or UMR. And you're basically given the option of two different plans, what they call the Advocate Preferred Plan or the Advocate Select Plan. And I always try and tell residents that the easy way to remember this is Advocate would prefer you to be in the preferred plan versus the select plan. The select plan is a little bit more expensive, but it offers you a little bit more options to go outside of the Advocate network. And we'll take a peek at that in just a second. Until a couple of years ago, we had like the option of choosing HMOs or PPOs. Both of these plans essentially function like a PPO, where you'll have freedom to go see any consultant or any subspecialist who's within the network. So if you want to see a cardiologist, if you guys were previously on an HMO, you had to get a referral from your primary care doctor. And all of these you'll be able to schedule directly as long as you're within network. And then 100% of all of the preventative care stuff, like your vaccines and any sort of regular USPSTF recommended screening exams, will be covered fully. So this is a very big slide, and you guys can review all this on your own time because it's just giving you kind of some rates, like for example, what you would pay in the emergency room. But more how I want you to view this is just realizing that this is the preferred plan on the left side, and this is the select plan on the right side. And the most obvious difference is there's less columns, right? So in this preferred plan, you have an AAH or Advocate Aurora Health Network and then everything else is out of network. Versus in the Select plan, you have an AAH network, Advocate Aurora network. You also have access to the United Healthcare network, and then out of network. And so what that means is basically in the preferred plan, every doctor that you will see will be an advocate doctor or associated with advocate very closely. And anybody else is out of network, which means like NA, meaning none of it's covered, you're paying out of pocket with the exception of ER visits because you're going to go to your nearest ER. So they're required to pay for that. Versus if you choose a Select plan, if you don't want to see an advocate doctor specifically, let's say I wanted to go see a cardiologist who's associated with University of Illinois, I could check in the United Healthcare portal to see if they're in their network, and I would have the option to see them as well. However, you'll notice that the price for all of these visits are going to be higher. So it's always going to behoove you to see somebody in the advocate network, but at least with the Select, you would have the option of the United Healthcare network. So what does that mean to you guys? Everybody's in a slightly different healthcare situation. And basically the things that you've got to consider is what is your medical history? Where are you coming from? And what doctors do you already have? And do you have a family who you're covering as well? So I'll give you an example for me, which is not a HIPAA violation. I showed up, I had no medical problems. I had no doctor. I had basically no allegiance to anybody. And so there was no reason for me to pay for the Select plan. It was much cheaper for me to do preferred plan. And I knew if I needed to see a doctor for any reason, I would see an advocate doctor. If God forbid I developed a neurologic issue, I would go see an advocate neurologist. Versus I had some of my classmates who started residency and they may have already had a specialist who they had a relationship with for a chronic issue. Now, if that specialist was in a different state, if you came here from California, unfortunately, you're probably done seeing them anyways because you're going to be paying out of pocket. They're almost certainly not in network. But if you went to Midwestern or Rosalind Franklin or UIC and you have a doctor who's in Illinois, there's a decent chance that they're actually in the United Healthcare network. And so if you really want to continue seeing them, it's worth looking to see if they're in the United Healthcare network. And if so, you may decide that it's worth paying a little extra for the Select plan so that you can continue to see that doctor, understanding that like your copays and deductibles are going to be higher if you do so. Similarly, if you have a kid who's got any chronic medical issues or a significant other who's got a chronic medical issue and needs to see somebody, you're going to want to consider that if they're going to be joining you on your insurance. So how do I figure out if my doctor is AAH or UMC network? Basically, AAH is anybody who is AMG or APP. And we talked a little bit about this during our How to Admit a Patient lecture, and we'll look online in a second. But basically, if they're affiliated with advocates, they're going to be within the AAH network. If you want to figure out if they're in the United network, you basically have to log into the United portal, which you can do without even having a membership and just see who's in their networks, or you could call United directly and ask. So if you're somebody who has a pre-existing relationship with a specialist, it may be worth doing that. We looked at this during the lecture, but basically if you were to Google anybody associated with advocate, like for example, I throw up here Dr. Chandra, he's one of the local PCPs. He's not AMG, meaning he's not employed by advocates, but he's APP, which means he agrees to be a part of the network. So it says independent practitioner, but I can tell from his webpage without even thinking that he's an advocate doctor. Versus anyone who says AMG is always going to be a network. One note is if you're showing up and you're picking doctors for the first time, it's always going to be cheaper to see an AMG doctor at an AMG site than it is even an APP doctor. It's always going to be the lowest negotiated rate. And so like when I was picking my kids' pediatricians, there were several local APP or advocate associated pediatricians who are not employed by advocate who were options for me. And I ultimately chose to see the AMG doctors instead. I've got a 3-year-old and a 1-year-old. And so it was the first time I was getting a pediatrician when they were born. Every visit, it saves you a little bit of money. When my daughter, when they were concerned for like hip dysplasia and she needed x-rays, we did it at Advocate Lutheran with the advocate radiologist, with our advocate pediatrician. All those people were AMG, and that really keeps the cost down. So it's not necessarily a huge cost saving, but if you have no affiliation or allegiance with somebody else, it's probably always cheaper to see an AMG doctor. A lot of you guys live downtown or in the South Loop, and oftentimes your nearest site there is the Psych Center, which is kind of near the old Mercy Hospital. That's the Advocate Center there. And there's basically PCPs and most specialists, OB-GYN, endocrine, everybody there. And so those are all AMG doctors. Similarly, if you're up on the north side, you could basically stay near Masonic and you'll find all the AMG doctors you need. So you'll have options near you almost no matter where you are in Illinois. Quick look at the premiums. So you guys are going to fall somewhere in this $40,000 to $80,000 category. And so you're seeing just a look at the difference in prices. So it's really only a couple bucks every pay period to go from the preferred to the select. If you're single, it gets a little bit more expensive with your family, but at this income level, really not a huge difference. And so if you're on the fence and you can afford a couple extra bucks per pay period, not a huge deal really. I crunched the math just to give you an idea. Like some people look at this, especially if you've been on, some of you guys come in and you've been on Medicaid for a while. So it may look expensive paying this, or in my case, I'm paying 190 for my family. But when you realize actually Advocate puts on your paycheck like what they're contributing. So I pay 190 per pay period, but Advocate pays $848 on my behalf for this insurance. And so they're shelling out $22,000 a year for me to insure my family. When you put it in perspective like that, you realize like, okay, this is pretty good coverage, and I'm kind of they're saving me a lot of money by doing this. So how do you find a doctor who's in your network? The easiest way to do it, particularly if you're trying to stay within that AAH network, is to go onto the Advocate site. And so you go to advocatehealth.com, you'll click on Find a Doctor. Oops, sorry about that. You'll click on Find a Doctor. You'll put in your zip code. I put in 60605, that's the South Loop. And then you can pick what's down here, select only Advocate Physician Partners, that's APP or AMG. And basically put in what specialty you want. You can choose anything from this tab, and then it's going to spit out like who's the closest to you. And so I lived in the South Loop during residency. If I had plugged in where I lived, they're going to immediately throw me these PCPs over at the Psych Center. This is the location there on South Martin Luther King Drive, and you can just click and immediately schedule with them. A word on just some quick hints. So there's a couple of pretty big surcharges that you could avoid paying if you're proactive here. So the first is the spousal surcharge. And so basically, Advocate doesn't, in an effort to save money, they do not want to be covering your spouse if your spouse has insurance. And so I'll give you an example. When my wife and I first got married, she was working full-time at Northwestern. As a result, she was offered health insurance by her employer. So Advocate would not have wanted her to be on mine, where they shell out $20K a year for us if Northwestern could be doing that instead. And so if she had elected to be on my plan, I would have paid $50 per pay period to keep her on my plan. And depending on your situation, that may be worth it if your partner's insurance sucks, for example. However, if you have a spouse who's on your plan and they aren't eligible, then you can get that surcharge waived. You just have to prove that they're not eligible for insurance by their employer. So my wife has since gone part-time after having children. And because she works less than 50% of her hours, she's not eligible for medical insurance at Northwestern, so she has to be on mine. And so every year her boss signs a piece of paper, this surcharge waiver that says she's not offered benefits here. You upload it into the Advocate portal, and then they waive this surcharge so that you don't get charged it. The sooner you do this, the sooner they waive it. And so you want to do it immediately so that you can get it waived right on the first pay period. Similarly, there's a tobacco surcharge. So tobacco causes cancer and a lot of other health issues, cardiac disease, etc. So it's more expensive for them. If you smoke cigarettes, they want you to stop so that you have less medical issues. And so basically, if you smoke, you're going to pay more for your insurance. And this is pretty common now everywhere. So when you guys first start, they're probably going to swab your mouth for tobacco. They actually take a swab on the inside of your lips. And if there's no signs of any recent tobacco use, then you're going to get this waived. With each upcoming year, you just have to attest that you did not smoke. And so this is important. So when you go to re-enroll later this fall, you have to go into the portal and make sure you click that you don't use tobacco. If you do not do that, they're going to charge you this $50 surcharge. So it's really important that you stay on top of that every year. And then a quick word on behavioral health. Quite frankly, United Healthcare is not the greatest insurer for behavioral health, meaning if you have a therapist or a psychologist. We were previously on Blue Cross Blue Shield. We switched to UMR a couple of years ago. And I could just say, even within my own family, our therapists were no longer in the UMR network. And so we were faced with a decision whether to pay cash or to switch our providers. So if you have a pre-existing relationship with a therapist, or you're doing teletherapy appointments, it's worth hopping on here to figure out if they're in network. And unfortunately, there's a good chance that they're not. And so you're going to be faced with a decision, which is basically paying out of pocket which can be pricey, or kind of slowly transitioning over to a new therapist. And I would urge you all, if you're somebody who has a therapist, you should do that now, because residency is not the time to like go cold turkey on your behavioral health care. And so it's worth going onto their website and kind of plugging it in. And then I include this information, which is the behavioral health portion of Advocates Insurance is called Access. And I've included some information here, including their email. The one thing they do offer is this care transition service. So if you are coming in from Wisconsin and you have a therapist you've been seeing for years, it's going to be really hard to go cold turkey and just like switch over now. We did this. I did this with my wife, for example, when we switched from Blue Cross Blue Shield to UMR. She had a therapist she had been seeing for decades, right? And so rather than just immediately paying out of pocket, we applied and asked for a transition period, which was ended up being a year. And so for a year, we would get our bill, send it in, and Advocate would reimburse us. And that gave us some time to meet a new therapist who we were comfortable with and for her to continue care with. And so I would encourage all of you that if you are going to have to make a transition because of the network change, to reach out and see if you can get coverage for the transition period. So our dental provider is Delta. Delta is pretty universally accepted. Almost every dentist in the Chicagoland area is going to take Delta. And so that part's really nice. This is, once we move away from medical and move to dental and vision here, the networks are much less restricted. You don't have to think hard about it. And so you're going to be given two plan options, standard or enhanced. And I've included the premiums here. This is not a lot of money. For most of you guys, this is $8 to $10 per pay period. And there's not a huge difference in these plans except for the orthodontic component. So basically, really what the enhanced plan offers you is more orthodontic coverage. There's slight differences in the payments here, but really most of this is not meaningful. So if you don't have orthodontic issues and you don't have kids who need orthodontic issues, you're probably totally fine with the standard plan, is the moral of the story there. Or if you have like a complex kind of dental history. And then our vision provider is iMed. Again, one of the larger eye insurance or optic insurance companies, and so pretty universally accepted as well. Again, very affordable for most of you guys. This is just a couple months a month. You should absolutely be doing this if you wear glasses, or honestly, most of you, just because who knows, you may need them at some point during residency, and this is pretty affordable. The network here, I just point this out, the in-network versus the out-of-network costs. And so there is some coverage for out-of-network, but it's definitely more affordable to stay in-network. And similar to all of these, you can just hop onto the iMed website. This is a huge company, and just see who's in-network. I think most notably, like the big online, a lot of the online sellers like Warby Parker, for example, they're out-of-network. And so you don't get as much coverage there, which is something to keep in mind if you've used them in the past. I include these hints here, which is in my own experience, having shopped around a little bit. Actually, the Target Optical is like the most affordable in the network that I've found. I used to do Pearl Vision. It was getting kind of expensive, and so we moved to the Target. If you're getting contacts, like contacts are contacts, doesn't matter where you go. So just go to the cheapest place. For glasses, like, Target definitely is not going to have as stylish of lenses, but it just really depends how much that means to you. Retirement account information, basically you get a 401k and you get a match up to the first 3% of your eligible pay. So it's a pretty, that's a pretty nice offering. A lot of residents don't get any match. In addition, you get a non-elective match. And so basically, whatever you contribute, Advocate's going to match you up to 3%. But even if you don't contribute, they're going to make a contribution on your behalf, which is a really, really nice benefit as well. So you're making money even if you can't. So take a look, see what you can afford. Even if it's just a couple bucks, I encourage all of you guys to get in the habit of doing some sort of a 401k contribution. Because it's a good habit for life. And as soon as you graduate, you should really be maxing out your 401k. We'll talk about that during the LAR lectures, or the Life After Residency lecture series. You vest after 3 years, which means if you were to leave before 3 years, Advocates contributions come out of the account. You don't get to keep those. And so luckily, this is a 3-year program. So as soon as you finish residency, you guys vest. And so the money that they match, you get to keep, which is really nice. Excuse me. I just throw this slide in. We're going to talk a lot more about this, like I said, in the LAR, but here's why it matters is if you look at 401ks and kind of how anybody retires in this country anymore, because it's so expensive. If you were to max out your 401k during the course of your career, a 30-year career, the contributions from you are in yellow, the contributions from an average yielded index fund are in green. And so you end up at the end of your career, more of the money is really just coming out of the interest that you've made rather than the contributions you've made. And so this is why it's important to get in this habit. Don't worry about this now, but the moral story is anything you give to a 401k is a good thing. And then I always include in here, there's a bunch of random discounts. If you go into the advocate portal, the benefit portal, once you've got a login, they offer a discount on like almost everything from like computers, AT&T and Verizon services. I get my dog's insurance, my pet insurance through Advocate because it's cheaper. Rental cars, kind of any purchase you're going to make, it's probably worth popping in just to see if you get a deal. Most of them are getting you like 10% off. Sometimes it's even more than that though. So keep in mind, if any big purchases are coming up, it's worth checking it out. We talked about this before. I need evals, as do some of my colleagues. So I'm going to count this as a lecture. So when you're done, hit the QR code and just give me an eval so I can put it in into my portfolio. And like I said, if anybody has any questions, just hit me up via email or text, and I can hook you up with the right people at HR as well. Thanks, guys, and I'll see you guys in the room.